Stay safe. Wash your hands at the running water for at least 20 seconds. Sanitize your hands and please stay at home. There comes a time when we hear a certain call, when the world must come together as one. There are people dying from coronavirus. It's time to lend a helping hand. We can go on if we listen day by day to wash our hands and try to stay at home. 'Cause we are all part of God's great big family. And it's true, the love is all we need. We are the world, we are the children, we are the ones to make a brighter day. So let's stay at home, try to stay at home. There's a chance we're making, we're saving our own lives. Sanitize your hands and wash your hands day by day. Remind someone to do the same thing too. 'Cause there's a chance we're making, we're saving our own lives. It's true, we know love is all we need. We're making, we're saving our own lives. It's true, we make a brighter day. This you.
Good evening, everyone, and welcome to the health segment on Trend Africa TV. I am your host, Empress Mausi, and I'm being joined by our regular professionals today and a special guest. Today we will be giving you our thoughts on how to prevent and manage the spread of COVID-19. Viewers, I would now like to appeal to you to please share this feed, invite your family and friends, and try and like us on Facebook, follow us on Instagram, on Trend Africa TV 123. I hope we are all doing well today. It's a beautiful Thursday. We're going to try and be bringing you this health segment every other Thursday at 6:30 p.m. Central Time. For now, I would like to appeal to all of you to please share the feed. I would also like to thank our sponsors of the program, which are the Ghana National Council, Omama TV, Powerhouse Media and Restaurant, Holiday Africa, Mados Designs, and Odinuhun Designs. Don't go anywhere, viewers. We'll be right back.
Before, there was no football match that I, Patentin Papani Papafield Esophagus, will prevent my optical nerves from witnessing. But since the unwelcome, ubiquitous, and hazardous coronavirus I have nipped all public commingling, interfusion, gathering, and cocoon myself to my permanent place of domicile. Health authorities and aficionados have outlined a few steps to follow.
We never see this kind of thing before. What the Covid19? We never hear this kind of word before.
Wrong. Please sneeze into a tissue and dispose it off immediately.
This kind of virus is here to kill. So make we take all the precautions.
Wash your hands with soap under running water or clean them with alcohol-based hand sanitizer immediately before touching any object, especially objects with public usage.
This kind of virus, you don't know rich, you don't know poor person.
Also drink a lot of water intermittently, exercise, and have a lot of rest. I appeal to you, proletarians, bourgeoisies, lads and themselves, let's be mindful of our actions and inactions. Let's follow the do's and don'ts as outlined by health experts so that we contain this pandemic that is causing pandemonium, ululation, coronaphobia the world over with abracadabras,
coronavirus, we never see.
Hey, what's up, guys? So look, this morning I got some test results back for coronavirus and it came back positive. Yeah, and it sucks. Listen, I'm doing okay. Sabrina hasn't been tested and she's doing okay. I didn't have any symptoms. I got tested because I realized I was exposed to someone who had also tested positive. I found out last Friday that they were tested positive. I quarantined myself and got a test immediately and got the results back today. Look, this is serious, you know. Now's the time to really think about social distancing, washing your hands. Beyond that, there are people out there who aren't showing symptoms and that can easily spread it, okay? So now's a real time to be really vigilant about washing up.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Welcome back, viewers, to the health segment on Trend Africa TV. I am Empress Mausi, your host and your original host for this program. I am honored once again to be joined by our professional team made of our special guest, Dr. Paul Quartey-Kumapley, who is a public health physician and practice in family medicine. Also, we are also joined by our beautiful Miss EuniceCromwell, or Mrs. EuniceCromwell, I'm sorry, a family nurse practitioner who provides comprehensive care to patients of all ages while emphasizing on disease prevention. Miss Eunice is also the business manager for the Ghana National Council of Chicago. Later on in the segment, we would be also joined by the knowledgeable Dr. Edward Ofori, who is an assistant professor of pharmaceutical sciences at the Chicago State College of Pharmacy. He is a trained pharmacist by profession as well as a researcher in mental health and neuropsychiatry. Ladies, you are welcome to the health segment on Trend Africa TV. Dr. Pearl, are you there? We cannot see you. Sound check. Dr. Pearl, are you there?
Hello, I'm here. Hello,
Welcome to the
everybody.
health segment on Trend Africa TV.
Thank you for having me. Thank you.
Anyway, you have a very beautiful smile.
Thank you.
Miss EuniceCromwell, are you also there?
I'm here. Thank you for
You
having
are
us once
welcome to
again.
the program once again. So, Miss Eunice, can you give us some updates on COVID-19, please?
Sure. What I really wanted to emphasize on today is that within the last week or so, the CDC came out with some additional symptoms that they're asking us to look forward to in terms of COVID-19. And since this is a new virus and we've never seen it before, it's very important for us as a community and as healthcare providers to make sure that everyone is understanding what they need to be looking for in the event that these symptoms should arise. So we know from the previous two shows that we've had that the basic symptoms of the coronavirus or COVID-19 is a fever that would be above 100.4 or greater, cough, shortness of breath, or difficulty breathing. So those are the main symptoms that we were looking at. However, the CDC has added chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss or sense of smell and taste, fatigue, and then also they notice that it causes more DVTs and CVA, so more like blood disorders. And so it's important for us to know this because we are also in a season where there's allergies going on, and a lot of people also have problems with their sinuses. So you need to be able to identify if these are symptoms that you need to be concerned about, need to start quarantining yourself for 14 days, or if this is just your normal allergies that you go through, or perhaps even the flu, because we're also in flu season as well. So I think it's very important for us to, understand those symptoms. Remember the incubation period for the COVID-19 disease is between 2 to 14 days, and 25 to 50% of people that are carrying it are asymptomatic, which symptoms. So that is just another reason why we really need to take the social distancing very serious. We need to make sure that we are wearing our masks, because if you're thinking that, I just want to visit my friend and my friend is not having any symptoms, that doesn't guarantee that your friend does not have coronavirus. And it also doesn't guarantee that you won't be able to also get the virus yourself. Unfortunately, we've also found out, and Dr. Pearl will emphasize more on this, that African Americans are at an increased rate for morbidity and mortality. Please also remember that the most vulnerable population in general for this COVID-19 disease is patients that are 65 years of age or older. Infants and young children have also died from this virus. So first we were saying only old people, but now we've seen on the news that infants passed away, and also some younger children and young adults are also passing away from this virus as well. We also take special precautions for our patients that have chronic diseases, as in asthma, chronic lung disease, our diabetic patients, cardiac patients. We encourage all of our hypertensive patients to continue to take their blood pressure medication. Also think about the patients who are on dialysis that have chronic kidney disease. Those patients who are severely obesity. And people ask, well, what does obesity have to do with the COVID-19? Well, obesity in itself puts you at risk for heart disease and stroke. So it's just following that same thing. If you have 3 of those diseases, it puts you at risk for a metabolic disorder, and that also puts you more at risk for developing or contracting, I should say, COVID-19. So also, we have to also remember anyone who is immunocompromised. What does that mean when we say immunocompromised? Those are our patients that have cancer. Those are also our patients who are on long-term steroid use, leukemia, HIV, bone marrow, organ transplant, chronic liver disease, hepatitis C, or cirrhosis. So we need to just put all these things in consideration when we're thinking about our family, when we're thinking about our friends. If they fall in this category, they are considered to be more vulnerable. And we need to all be trying to help out our fellow people, our neighbors. If you can pick up groceries for someone, if you can pick up someone's prescription, it would help tremendously because these people are very vulnerable to the disease, and the disease is still killing people on a daily basis. Let us also just remember that emergency care, if you're having difficulty breathing, persistent chest pain or tightness, new altered mental status, that means that you're all of a sudden confused, unable to easily be awakened. And of course, if you're having blue lips or a blue face, you really need to be in the emergency room. You need to call 911 immediately. So those are our updates in terms of the coronavirus, the new symptoms from the CDC, and what we need to be looking out for.
So Miss Eunice, with this allergy season that is around now, how would you differentiate if you are just having an allergy or you are actually you have contracted the coronavirus? What are the differences, or what should we be looking out for?
So when you think about allergies, think more about like sneezing, runny nose, facial pain, post-nasal drip. That's when the mucus is dripping down the back of your throat.
Okay.
Itchy eyes. Those are all more of allergies and the common cold.
Okay.
So typically we don't see those things in COVID-19. And it doesn't mean that you won't see them, right? Because everyone's body reacts differently. But from the research that they're doing, they're telling us that we're really not seeing that. So if someone presents with those symptoms, the first thing that we would probably want to do is put them on like a Claritin, a Zyrtec, maybe some Benadryl at night, to see if those symptoms would just, go away. But if you're having the fever and that dry cough and everything else, then we have to think more of COVID-19. And also, they're doing an assessment screening. One thing that I do probably for about 50% of my day is screening patients through telemedicine for COVID-19.
Right.
And some of the questions are very, very particular. They want to know, have you been around anyone that's been exposed? Because that would also let us know your potential risk of contracting the disease. So all these things come into play, and luckily, Illinois has opened up so many testing places, and I'll post those on our site here so people can be aware. There are places that you can go and get tested. Swedish Covenant Hospital is testing people for free. You just pull up there and they test you with no questions asked. There are even some agencies that will come to your house and also swab you and do your testing. So definitely we are getting to a point in the disease. We're in a different phase of this disease, and the government is issuing out more money, more testing supplies, so we can be able to really see exactly the percentage of people that have it. Remember, the more people that have it, the more immune people are going to be.
Right.
And in the end, that's going to help us all.
Right. So with the percentage or with the rate of minorities who are losing their lives to the COVID-19, I was reading in the news the other time that testing centers are now being opened in minority dense areas. Are they doing too little, too late? Don't you think?
I think it's a great idea that they're opening up testing centers in the more minority areas, but you have to also understand one thing, that it doesn't matter how many testing centers they open in an area where they think is more minority. The problem is, are the minorities going to utilize this service?
Are they going to show up?
There's always two sides of a coin, and I'm very happy that we have this topic tonight because people are saying that, only Black people are this, only Black people are that, but what are we also doing to prevent us from getting this virus? Are we taking the proper actions? Are we making sure that our blood pressure is in check? Are we making sure that our diabetes is under control? These are things that we are responsible to do before you even think about going to a testing center. So I'm very happy that they're putting more testing centers there. It is my hope and pray that the people living in those communities will really understand their risk, understand what the signs and symptoms are, quarantine themselves if they were having these symptoms, and of course reach out to their primary care doctor. And then it comes to the question, what if they don't have a primary care doctor? Well,
Right.
we need to be utilizing our public health clinics. They would be able to help us tremendously through this.
Miss Eunice, is it too late for anyone to get the measles, mumps, and rubella vaccines and the flu vaccine? Is it too late now?
So definitely flu vaccine. The flu vaccine is actually going to be coming out pretty soon. I think my manager told me she just placed an order so we could start giving people the flu vaccine. Measles, mumps, and rubella is something that you need to get when you're younger. I know that when people get older, they will draw titers to see how
Right.
much of the medication is in your system to make sure that you are immune to it. But and we can clarify this with Dr. Pearl. I think when you get older, you can't get those type of vaccines, if I'm not mistaken.
Okay.
I think you at a certain age, it cuts off that you don't get the vaccines, and you more just get that the Tdap. You get the Tdap every 10 years, if I'm not mistaken.
Right. Okay, let's go over to Dr. Pearl Quartey-Kumapley. However, we're going to take a short break and we'll be right back. Don't go anywhere.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
What it do, my people? It's your boy Kingsley Ego B, aka King the Preacher, aka the Peacemaker, aka the Joy of the People is my peace of mind. You are now watching Trend Africa. Don't touch that dial. If you won't touch her. Come on there. Keep watching Trend Africa. We are here. Africa has come to stay. Don't touch that dial. One love. Keep watching.
Welcome to Africa. Hey, Mama Africa, the land of peace, gold and diamond. Welcome to Africa. Hey, Mama Africa, dark and lovely, beautiful people. Hey, 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 don't mind what people say. I said, don't mind what people say.
Hello again, viewers. This is Empress Mousy, your host of the health segment on Trend Africa TV. We are honored to be joined by the beautiful Dr. Pearl Quartey-Kumapley. Like I said earlier on, she is a public health physician and practices also family medicine. Dr. Pearl Quartey, welcome again to the show. Dr. Pearl, could you please tell us a little bit about your profession?
So my primary profession is a family medicine doctor. So meaning I take care of patients from infancy all the way to through adult life and through old age. I also have a special interest and special training in public health. So I also do some work supporting the Cook County Public Health Department as well.
So, as a public health doctor, what is your role? How what is your role in this COVID pandemic that is going on right now, and or has your role changed since this pandemic?
Yes, so public health is a very broad area with different aspects of it. And the main goal of public health really is to ensure the health of populations, right? So it can be the population of a city or a county. In the U.S., this is how we've broken it down either by a city or county.
Okay.
And then on the national level, we have the CDC sort of like, overseeing a lot of our public health. So public health then, of course, needs a public health workforce, which includes public health doctors. So there are epidemiologists who can also be doctors. There can be nurses, public health nurses. So the functions of a public health doctor actually is very versatile. In my particular role, what I do with the Cook County Health Department is work with them on various projects.
Okay.
Specifically with the COVID-19, the way that me and my colleagues have been involved is since the first case was reported in Cook County back in January,
Okay.
we've been involved with that initial investigation of what happened, doing contact tracing. You may have heard that in the news a lot lately. Basically, tracking down the people that a case in any disease situation might have been come in contact with to see how far the infection has spread. And then gradually the third and fourth case, and then doing a lot of other things in the community with airports, with quarantining, until it became like an epidemic that we're dealing with now.
So, Dr. Pearl, are you able with the contact tracing? Are you able to reach everyone? And how is the process? What is the process of contact tracing? How do you find out who's been exposed?
Yeah, so contact tracing is almost like being a detective, an investigator. So basically, when let's say you have let's say a first initial case, you're literally asking the person where, trying for them to go back. In our case, 2 weeks, maybe a month. Where have you been? Where did you go? Where do you work? Who have you been in contact with? Literally going day, almost hour to hour, day by day for the last week or two to see where this individual with the disease that we're looking for has been. And then looking through and saying, okay, let's say this person went to a certain shop,
Okay.
and then literally going like, what time did you go to the shop? And then literally tracing to the shop and say, okay, who was in the shop? If you went to a doctor's office, what time did you go? How long were you there? And this is how I literally one by one piecing through the person's life for
Right.
the preceding 2 or 3 weeks, and then hopefully we can get some of the locations, and then be able to track some of the people that were in that location at that
Right.
time.
Right. Wouldn't that be very overwhelming? Because in the United States, I think how much in the United States so far, our numbers worldwide is 3,905,478. So imagine in the United States we have to or Illinois. Let's just take only Illinois.
Mm-hmm.
Illinois is
68,000.
yes. So
Yep.
would you contact trace for 8,000 people?
68,000.
68,000 people. I'm sorry.
So, yeah, so you're absolutely right. So contact tracing is most valuable in the initial phase, right?
Okay.
So when you can trace so let's say you have one case and then you find out that in the last 2 weeks this person has been in contact with maybe 400 people. You're literally going to call all these 400 people,
Okay.
and you're going to ask them, how are you feeling, what are your symptoms, et cetera, of all these 400 people.
Right.
And then if one of those 400 people, ideally you should be testing all those 400 people.
Wow.
But the challenge that we were having, particularly with COVID, was the fact that the tests were very, very limited in the beginning. So some people were tested based on the symptoms that they were having, but not everybody was going to be able to get tested. Now, so based on that, then you're going to take those 400 people and try to find out their contacts if there's a positive case, and so on and so forth. So as you correctly identified, contact tracing becomes very, very almost impossible when the infection spreads in the community,
Right.
and it's almost like now almost everybody has it. So then it gets to a point where the public health department logistically cannot do contact tracing.
Right.
However, there are situations where you can still do some investigation. So, for instance, there might be an outbreak in a nursing home, for instance. So it's important that even in the bigger outbreak that's going on, you do contact tracing in the small epidemic that might be going on, say, at a workplace or at a nursing home,
Right.
to kind of track, okay, what happened, who needs to be separated from whom. And in those settings, those are called congregate settings. And in those settings, then you can kind of do some amount of contact tracing within the bigger epidemic that's going on. What's important in contact tracing is testing, right? So you're tracing all these contacts, you should be able to test them. And that's been one of the limitations that we've had in the US, is because we can't test people.
Right.
And as Mrs. Cromwell identified, there are so many people, we don't even know exactly what percentage of people that actually have the coronavirus that are asymptomatic, meaning they have the virus in their nostrils when they're talking. They give out, little droplets with the virus, but they themselves have no symptoms at all.
Right.
And these people are like in the community and we don't know. And the way we can actually know is to test people,
Right.
both people with symptoms and people without symptoms. So we're gradually getting to the point where testing is becoming more accessible, where now more communities have testing. So there is some talk about actually doing contact tracing on a national level, and that's going to be extremely challenging. There's been some estimates about maybe we're going to need, 100,000 people to do contact tracing for all these people. And it's going to be really interesting to see how that plan happens going forward.
Okay. So you were talking about nursing homes being hit with the virus. Why do you think it is worse in the nursing homes? Because we have residents that are not going out. However, they are the ones that are being hit most in the nursing homes. Where do you think the problem is, and how can we start cutting down those numbers in the nursing home?
So that's very true. So the thing about nursing homes is, actually nursing homes were one of the institutions that very early on in Illinois here, they actually put a lot of restrictions even before the stay-at-home order happened and the social distancing orders were given to this whole state. The nursing homes were actually already having some level of surveillance by the health department.
Okay.
So, like for instance, they couldn't go to the dining room where all of them would gather for meals. They had to stay in their rooms and stuff like that. As you know, even though the residents of the nursing home live there, the people that work in the nursing homes come in and out of the nursing home, right? They go home, they're in the community, they go home to their husbands and family members and all these things. And once there's community spread and there are people that can carry the virus without having symptoms, then let's say, for instance, let's say I'm an employee, I don't have symptoms, but I have the virus, or maybe I have a mild cough, mild cold, like in flu season, we're all sniffling.
Right.
And that. And then I take it to work. And in the beginning, because we're all not very conscious or very aware of the COVID-19, then the virus starts spreading. And then in the nursing home is where we have our most vulnerable population.
Right.
First, their vulnerability, it comes with the age. And then the next vulnerability is the fact that because of their age, a lot of them have what we call comorbidities, meaning diseases that make them more susceptible to getting sicker with the virus as well as dying from the virus. And then once the virus starts, then it's kind of hard to control. You have to literally test everybody in the nursing home. You have to separate the positives from the negatives. You have to test all the employees coming in and out. It becomes quite challenging.
So if I'm an employee of a nursing home and I tested negative today, could I test positive next week?
You could, depending on where you've been and where
So
you go.
how often should I get tested as an employee?
That's a very good question. So those are some of the things that are tough decisions now that public health officials have to deal with, because when, as I said, we have an issue with the testing, right? So if you test negative today, we're assuming that you don't have the virus, and as long as you don't have symptoms, we're assuming that you still don't have the virus, but we don't know, and we can't say everybody should be testing every week.
Exactly.
So this situation is a very challenging. The coronavirus is a very challenging situation. So I think that as more and more tests become available, we're going to be able to have the rapid test. So then that could help us, get the test. So maybe, for instance, when people go to work, they can be tested at the beginning of the shift. What they're doing now is the temperature surveillance, right? So at
Right.
most places, people get their temperatures checked in the morning, and then, with every shift. And they actually pick a lot of cases where people have a fever, their temperatures are elevated, but they're walking around like they're not sick, and it's just the temperature
Right.
their temperature is what triggers them to get tested because they've been screened at work, and then they find that they're positive. I know a lot of people, pharmacists, nurses, a lot of people that were picked up that way with that temperature monitoring.
So what if you don't have a fever? How if you don't have a fever and you keep testing me um for the virus and I'm asymptomatic? What do I still keep walking around and taking care of my patients
So we
though I
don't know,
have no fever?
right? So you don't have symptoms. So some of the policies, it depends on what the nursing home policy is, right? Like if we have to test everybody every week, can you imagine? I mean, that's a lot of testing. So again, it's the limiting factor here is the availability and the access to test, because the other thing to you test and it takes 2, 3. At first, it used to be 4 or 5 days to get the results back.
Right.
And then now it went down to maybe 2 days, and now I think we're at 16 hours. And then there's some of those rapid tests which have been found to be still need a little bit of ironing out. But I have a good feeling that very soon we're going to be able to have a rapid test, sort of like a pregnancy test, where you can take a little bit of maybe saliva or something, and you can see whether you have the virus or not.
Right. 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 Um. Here in Bolingbrook, in one of the nursing home, a healthcare worker who is a nurse called Chris Angeline Guzman, fresh off, she just got off a maternity leave, just passed away last week, and she's only
Oh,
31.
wow. I haven't heard this.
Yes,
Wow.
it's in the news. She's only 31. She just got off maternity leave, started working, and within 2 weeks, she lost her life.
To
So
COVID
to
19.
COVID-19. When she even started working, I heard she had to purchase her own PPE out of her own pocket because the nursing home wasn't able to provide the essential needs they needed to take care of the patients. What puts Miss Guzman, what makes her puts her at a high risk to contract COVID-19? Though she did
Oh,
not have any under
underlying
right,
medical problems. Yeah.
exactly.
So normally, for a young 31-year-old, you would not expect that they would be so susceptible to the virus.
Right.
But that's the reason why the governor still insists on the staying at home, because we don't know what's going to happen to even young people. Something might happen. In her situation, again, I don't know the whole story. You're just telling me, but that shouldn't be something that we would expect that a young, healthy, recently delivered mom. Sometimes in pregnancy, your immune system is a little bit low.
Mhm.
Yeah, so you're not necessarily immunocompromised, but your immune system is a little bit altered because your body has to accommodate a pregnancy,
Right.
and that's the reason why, for instance, pregnant women, we always encourage them to get the flu shot, because they're one of the populations that are at higher risk of having complications from just getting flu. So, and then I don't know how long she's been postpartum, how long ago she had the baby. I mean, there's so many things I don't know about this case.
Right.
Yeah, you don't know. I mean, at first it was like, oh, it's just old people with diabetes and high blood
Right.
pressure, and it's at first it was like, oh, only people that travel to China, right? And then the next thing we know, it's like, oh, now it's Black people that are
Right.
dying.
Right.
And now, actually, recently, it's Hispanics that are dying even more, because now it's spreading, throughout the communities, and now has gotten into our Hispanic community,
Right.
and now they're dying a little bit more than Black people were like a couple 2 or 3 weeks or a month ago. So it's a very unpredictable disease, and this is the reason why we need to try as much as possible to stay home. In her situation, she went to work. There's the issue of the PPE that has been a big struggle for a lot of institutions to be able to provide adequate PPE, right? Usually nursing homes there's the flu and stuff, they have enough PPE, but not the level that you need to protect um, from the coronavirus. And this is a very, very, very tough case. I haven't heard this.
Dr. Powell, thank you. Before we go for a commercial break, I'm also a healthcare worker, and one of the I've been wanting to go get tested. However, I'm hearing employee health is asking for us to have a doctor's order for us to come over to get tested. Shouldn't testing for healthcare workers be more accessible?
You are absolutely right. Healthcare workers should be tested and should be able to be tested, okay? But so there's like pros and cons.
Okay.
So right now, let's say today you're feeling well, you have no symptoms. We know there are asymptomatic people that carry the virus, right? We know that. But you can go to work, you can do your function, you don't have any symptoms. You go to work, you put your PPE on, cover, you have your gloves, adequate PPE so that you're not spreading the virus, and you're social distancing at work as much as possible. I know it's hard, like if you're a CNA or something, it's hard to
Right.
social distance from your patient because you're like literally one on one with them.
Right.
But if we were to test everybody, and let's say 25% of the staff are positive, then that means 25% of the staff have to go home and quarantine for, you know what I mean?
Right.
So then that becomes a staffing issue. So it's a very, very tough balance between, like, okay, mass testing, which is good because then we know who has it, we know true the true incidence of the virus in the population. But then there's the issue of the staffing issue, because once somebody tests positive, you have to get them away from other people for a while.
Right.
But you'll say that, well, if they're positive, why do we still want them at work anyway? It's very, very tough,
Right. Right.
very. But I do agree with you that testing should be accessible. I don't know, who your institution is, but you can get a test from the health department.
Okay.
In Bolingbrook, I have to look to see where the testing sites are. I work in Chicago, so I know that more, even though I live out here. I know where the testing sites are in Chicago, but I honestly don't even know where they are here in the suburbs.
Okay, that is Dr. Pell, viewers. When we come back, we'll be tackling health disparities and how the numbers are just soaring high. Don't touch that dial. We'll be right back.
Thank you, Empress.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Welcome to Africa. Hey, Mama Africa, the land of peace, gold and diamond. Welcome to Africa. Hey, Mama Africa, dark and lovely, beautiful people. Hey, 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 don't mind what people say. I said, don't mind what people say. Don't mind.
What did you do for here? Come here.
It's like he was born for this. You think you can one day fall from a taller tree?
Pierre,
Take a look at him.
Oh, that's harsh.
no be your mama and baby match na banga before they send you for school. Be careful. What kind of fashion is?
Which kind of fashion?
My little career partner now tell you. I teach you what. Fine, Sote.
You just sweet my heart.
You no get place to stay, pa.
Some will do how?
Mommy, I beg.
Just carry that bag and come up quick for the coffin before this or two ain't no fine.
I said, come on for this house. Take him. No, na family money. Mama don't talk so, na family money. John.
Pa.
I think I know I do my work fine. Like Papa for look over.
You think that think?
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello, viewers, and welcome to the health segment on Trend Africa TV. It's been a long day, guys. Thanks for joining us again. And right now, we will take a little break and acknowledge some of our viewers on Facebook Live. I would just want to thank everyone that is joining us or has joined us and have shared the page. Thank you so much. I hope we can share this among ourselves to get ourselves educated. I would like to thank KB Upon for watching. And Amadogbe, she says, as always, you looking moi. Oh, thank you, Ama. I can't help it. Sarah Bruce Duncan says, Era Kwale Koti, Purple Queen, Moga, great show.
Go, Moga.
Oh, so you went to
Man.
Oh, okay. I see. Trudy Streeter is watching. Thanks for watching. Pel Yayua Agboka and Honfedia. Thank you so much. Rita Samakofiajo is also watching. Mama Patient Lochu, thanks for watching. Ki Mama, thanks for watching. Nana Chumesi, thanks for watching. Sena Alinko also says great question. Abigail Gasu Achampon is watching. Thanks for watching. Who else? New Evelyn Classic Adra, you are also watching. Thanks for joining us. Pearl Yara Agboka. So, how will Dr. Pearl advise someone who has been showing symptoms but tested negative? Should the person test again in a week or two if still showing symptoms? Could you please answer to that, Dr. Pearl?
Yes, so that's a very good question. That's a very good question, actually. So, if there's actually symptom checkers online, like you can go to the CDC website where you can, do the checks, and it will tell you that most likely you have the virus or not. If you test negative, there sometimes you need to be a little bit further into the illness to have a positive test. So we're seeing that those cases where sometimes the test will be negative, but then in a day or two they become positive. If you don't necessarily need to get retested, but you can do the self isolation and the self quarantine at home. If you're in a situation where you're in a high risk, like you're a healthcare worker, you're exposed to people, you need to talk to your manager about your symptoms so that you can stay home and self isolate and not spread it. And as Mrs. Cromwell said, the CDC has expanded the symptoms. I mean, these are symptoms that we in the healthcare field knew that was associated with it, and I'm happy that now it's widespread so that a lot of people can kind of know some of the symptoms that they should be looking out for when they're feeling ill. So we're coming sort of to the end of the flu season. So flu-like symptoms should be going down. Allergy symptoms are going up. And as Mrs. Cromwell said, the allergy symptoms, they're a little bit different with the stuffy nose, the itchiness, those are a little bit different from COVID symptoms. So you can kind of differentiate that a little bit. So I hope I answered her question.
Okay.
It's yeah.
So, Pro Yaya Agboka, let us know if your question was answered, and if anyone has any more questions, could you please type it in the comment section, and I'll be proud to read it, and our professionals will be answering your questions. I'm gonna go on and acknowledge Nana Yao Ketre Mafo is also watching. He's one of our sponsors, a really great guy. Subovi Koblavi is watching. And then Nana Yao Ketre Mafo says, that's my primary health provider, Dr. Pearl Quartey. So he's giving you an okay, about 4 okay signs.
That's good. I passed the test.
So, Togbi Simon Ado is watching. Thanks for watching. Victor Boafo. John Ziga is watching. Simon Ado say thanks for the information. Um, New Evelyn Classic Adra says knowledge is power. Lina Mensa thanks Dr. Pearl Moga Strong.
Yes.
Your Moga people, they are wild though.
Hey, we are welcome.
Sarah Bruce Duncan, thanks for watching. Francisca Moore, thanks for watching. And Pearl Yayra Agboka also say thanks for answering.
Wonderful. Thank you.
Okay, so we are going to be tackling health disparities in our community right now. Dr. Pearl, Quartey, and Mrs. EuniceCromwell. Could we before I go on, Mrs. EuniceCromwell, is there a question a viewer has that I haven't read out yet?
No, everything you've read I've seen on this side too, so we're good.
Oh, we're good. Okay, all right. So Dr. Pearl Quartey, Kumapley, could you please talk about health disparities in terms of this COVID-19 pandemic? What is
Yes.
going on?
Yes. So that is the really sad part of our health situation here in America. COVID-19 has really just uncovered some of the things that we already knew about the challenges of addressing health disparities in America. It's actually not different from a lot of other diseases that we dealt with. The surprising thing is how coronavirus COVID-19 was a disease that was initially, travelers coming from China.
Right.
When we're asking questions, have you traveled? Have you traveled? Have you traveled? And then the next thing we know, our Black community was dying the most. So there are multiple reasons why this situation has come to light. So first and foremost is the comorbidity issues. African Americans, Hispanics, we suffer a higher burden of comorbidities, high blood pressure, diabetes, obesity, heart failure. So then we're at higher risk of getting more seriously ill when we get the coronavirus, just like with the flu and other viral illnesses. Next is the fact that we tend to do a lot of the essential work, right? So now a lot of people are home trying to social distance, work from home, do telemedicine, but a larger proportion of our minorities are if they're not primary health, they're not healthcare workers. They're the cafeteria staff, they're the cleaning staff, the bus drivers. They're the people that have to go out. The higher majority have to go out and can't social distance, right? So because of that, then we're also at higher risk of contracting the virus. So that if it's even a younger person that is, doesn't even have the comorbidities, they can carry the virus, have mild symptoms, but then take it home. Okay. And then our community has the higher percentage of having multi generations of families. So there'll be a family where it's the grandmother, grandfather, the parents, and the children. And then there might be some college age kids in there, right? Maybe if they're great grandparents, they might be in there as well. So we have the higher chance of having multi generational families, so that when a young person in the family goes to work, they contract the virus. They themselves might get mildly ill or not ill at all, but then they'll give it to their grandparents, who then becomes ill and has to go to the hospital. Right. So some of this is happening on social media. We see the videos of where the young people in our community are not social distancing; they're still partying and stuff. I don't know if I would say that that's unique to our community. Younger people in general feel invincible. They feel like the disease can't hurt them. And so they're out, not following the governor's orders like they should. But what I'd like to tell them is that they have to think about the older people in the community. I mean, like you mentioned, we had a young, vibrant 31-year-old, I think 35, they said, who died from it. So we all have to be socially responsible and good citizens to help with the disparities. So this is just touching a little bit. It's like, there's like structures, there's like healthcare issues, accessibility to testing, people having to work because they have to work even after they're tested, and then that's how come it got into factories. So now there's like outbreaks in factories because they're not social distancing in the factory. So then people get it and then they take it home. It's like this vicious cycle that's happening in the minority community. Yes.
Okay. Dr. Pearl, I'm going to be talking about health insurance coverage. I know you mentioned that there's a lot of factors that is contributing to health disparities. And I also know, or I have to mention that not having insurance coverage is also one factor that I have also zoned in on. So if I should get infected with the virus, I know, would I be attended to without health insurance? Should I be expecting a bill in the mail? Would I be treated and expect a bill in the mail, or would my treatment level be different because I have no health insurance coverage? What should the community do if they have no health insurance coverage? Are there resources they can contact, or I mean, do you? I mean, just help
Yeah.
me out over here.
So that is a very big challenge, right? And this is the coronavirus has really literally let us wash America's dirty laundry in terms of healthcare
Right.
out in the world, right? Because in the developed country, I mean, even if you're undocumented or you don't have insurance, when you have a critical illness or an epidemic such as this epidemic that's going on, the ability to pay should not be a limiting factor.
Right.
But here we are, it is. So Dr. Ngozi Ezike, who is the director of the Illinois department, right? So in her daily briefs a couple of days ago, did mention that the testing in the testing centers is open to people regardless of your ability to pay. Okay. So depending on where you live in your county should be able to test you because those tests directly come from the state without you having to pay.
Okay.
Okay, so the testing shouldn't be an issue, as far as I know. So the first point of contact is your health department in the county that you live in, and then they'll be able to help direct you as to where the testing centers are where you live.
Okay, Mrs. EuniceCromwell, do you want to add anything or ask a question, or do you want to elaborate on any area?
No, I was just listening to what she was saying, and that is a very important concept of what she brought up about the insurance. And I think that is the biggest problem that why this is a pandemic, because I know here they have free testing centers, but then we have to think about our own motherland, Ghana, really has that system set up. And people who can't afford testing, or people who can't even afford treatment for any disease, not only COVID-19, but we're talking about preventative diseases that make you more susceptible to getting COVID-19. It puts everyone in a very, very big risk. And when you think about that on a public health aspect, the more people that are at risk and the more people who are getting COVID-19, that puts all of us at risk, whether we have insurance or not. So that is why I keep on telling people that this is not an issue where it's like you, your family, your church members, your cousins, your whoever. This is really something that we all must work together. Because even if your neighbors have it, it puts you more at risk. If you're living in a shared apartment complex and you don't own your own home, or the school that your kids are going to, or the play dates they go to, it's like it affects everyone on so many different levels. So it is very, very important that we understand that concept. And when the mayor is showing up and telling people to go home, and people are cursing her out, she's really doing this for our own safety. Because the more people who stay outside, you don't know who those people are now going to encounter. Look at the way Dr. Pearl explained to us how they have to go through the contact tracing testing. We're asking people what they've done for the last 2 weeks. Up until now, I probably couldn't tell you all the places I visited in 2 weeks because we're always so busy, right? So it's a very, very hard job. for the people who are trying to, hone down and get the areas of where the disease is more prevalent. So by us not following directions, by us not wearing those mandatory masks and everything, it is really, really a very huge challenge for the whole world, honestly.
Okay, so on the curve has plateaued. The numbers are not coming down, but the curve has plateaued. What I want to ask is, are the measures we are taking, is it helping the curve at all? Are things becoming better? I mean, better, or we have it's just at a halt right now? Dr. Pearl, if you could please answer to that.
Yeah, so fortunately for us in Illinois, I honestly believe that the governor putting in the social distancing, canceling like in March, we're supposed to have multiple festivals and St. Patrick's Day, like different things were supposed to happen. All of those were canceled. I think that really helped to reduce the rapid spread of the virus, which would eventually have overwhelmed our health system, right? So that was the whole idea, is to flatten the curve so that our health system can accommodate the infections. So I think we've been able to do that, to flatten the curve, but the infection is still persistent. So when you look at different counties, the infection rate is as much as 20%, right? So every day we're tracking the infection rate and we're hovering 20%. Like in Chicago, it's like 24%. So that's still pretty high. And these are the cases that we've been able to pick up and test, right? And we know that there are a lot of people out there that have not been tested. So it's flat, where meaning, we're not like going up, but we're stagnant, but the stagnation is still high. So I agree with the governor to extend the stay-at-home orders until the end of May. And then, as you know, there's been a comprehensive plan to kind of try and see how we can begin to reopen. And I have very good faith in our public health director as well as our governor that they're doing a really good job in helping reduce the spread. The biggest problem is the problem of the disparity that we're seeing, and how we can address that.
Okay. So with the world, as the world reopens, what creative ways can we take to protect ourselves from being hit by a second wave? Because it is likely we might be hit by a second wave if proper precautions are not followed. So what creative ways do you think one can take to you know to protect ourselves in terms of grocery shopping, visiting family in other states, and all that? I mean, what creative ways can we?
So I think the second wave is almost inevitable, because like you have let's say we've gotten the infection rate down, I don't know, to maybe 10%. That's just a hypothetical situation. So now we're feeling confident. We're like, okay, we can test. Everybody that wants a test can get a test. We can do contact tracing, like, okay, where have you been? So, because now it's like everybody has it, but it's not that much. So we can actually start to do some contact tracing. So we can actually trace where you've been and say, okay, we need to find out who else has it, right? So there's 3 T's: testing, tracking, and treatment. And then for those that actually get ill and need hospitalizations, we actually have a good treatment. And then, like, the perfect scenario is where we have a vaccine, right? This is like on the public health level. Individually, what we can do, maybe individually and then community, is that maybe not everybody needs to go to work every day, right? Like, if people have opportunities to work from home, now we've seen, like, it's been 6 weeks, and oh my God, the world still functions with people staying at home and doing teleconference, and we all don't need to be on the highway causing traffic, an hour and a half traffic jam to get into the city. So, so these are some companies can make it so that not everybody is coming into the office every day, right? They can make maybe a rota of who comes in and who doesn't. Um, Personally, I think families should kind of do the same things. Don't go to the store as much, like every day. Like, remember, every day after work, you go to the store, one little thing, and you go check out, right? It's like that's what we do. But now we can strategize it where maybe you're going to the store every 2 weeks, and then when you go, you're still having a mask and you're still social distancing, washing your hands, using hand sanitizer. All those things I think are gonna be literally part of us. Like, look at the Asian people. They wear masks all, like when you see the news, even when there's no epidemic, do you see them? They're like in
Yeah.
masks. Why are they wearing masks? Because they're so used to having these kinds of things, and then they're always like prepared and always. So it might come to a point where maybe this is how we might have to do even after we open up. Like, restaurants might have to not let everybody sit at every table. They might have to do every other table, for a while until there's a vaccine, so that everybody can be vaccinated, so that a lot of people don't get as sick. Um, so the CDC thinks that this might be part of us now, like how we have the flu coming every year. We don't know. It's a new virus, so we don't know how it's going to behave. But usually a virus like this that spreads throughout the world like this ends up behaving like the flu. It comes in every year, and then it goes out, and then comes in and goes out like we have the flu. But we don't know. It's a new virus. So yeah, so I think families are gonna have to uh, practice a certain level of precautions. The community is gonna practice a certain level of, and then companies and employees, even school. Like in the fall, we don't even know if the kids are gonna be able to go back to school. It's going to be very interesting to see how it turns out. But personally, families, I'm going to say do the same thing. Don't go to the store every day. I mean, even church, like, I don't know. I don't know if I'm going to church for a while. I think I'm just going to do the online church for a while. Because we don't know, because this curve can come back.
Yes.
And we've seen it in Asia when they started opening up. There was a little bit of a surge, but they're a little bit better at controlling it than we are. So yeah.
So I heard there's a new strand that is a mutation from the original COVID-19 strand. Is there is is this a new version of coronavirus out? Is there a new version out?
So that's what the scientists are saying. So, and it's not surprising. This is what viruses do. Viruses will find the best way to survive. They're very simple. They're like the simplest living thing, right? They need another organism's cell to live, and
Right.
then they take over the cell. And then imagine that you have to survive by using somebody else's cell. So you have to rapidly adapt to all these different cells that you have to live in so you don't die. So this is what viruses do. Like the flu, for instance, every year the flu virus mutates every year. So the vaccine that we're getting is for the flu viruses from the year before, which gives us a certain amount of protection for the coming year, but not 100%. It gives us a certain level and reduces the curve in terms of how many people get very sick from it. And so that's not surprising. I mean, I won't be surprised that there's even multiple versions, right? Because with every population that the virus travels through, it's gonna adapt to that population. So there probably might be maybe one or two other versions of it. We just haven't picked it up yet.
Right.
It's not surprising at all. And that's the reason why the scientists look for it, right? Because somebody had to be looking for it to find it, because they know that the viruses mutate. Yeah.
So viewers, we're gonna take a little break. We have to. I need to readjust my wig and make sure my
Yep.
eyelashes are in place. So we'll take a little break and we'll be right back.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Before, there was no football match that I, Patentin Papani Papa Phil Esophagus, would prevent my optical nerves from witnessing. But since the unwelcome, ubiquitous, and hazardous coronavirus, I have nipped all public commingling, interfusion, gathering, and cocooned myself to my permanent place of domicile. Health authorities and aficionados have outlined a few steps to follow.
We never see this kind of thing before. What the Covid19? We never hear this kind of word before.
Wrong. Please sneeze into a tissue and dispose it off immediately.
This kind of virus is here to kill. So make we take all the precautions.
Wash your hands with soap under running water or clean them with alcohol-based hand sanitizer immediately before touching any object, especially objects with public usage.
This kind of virus, you don't know rich, you don't know poor person.
Also drink a lot of water intermittently, exercise, and have a lot of rest. I appeal to you, proletarians, bourgeoisies, laws and themselves. Let's be mindful of our actions and inactions. Let's follow the do's and don'ts as outlined by health experts so that we contain this pandemic that is causing pandemonium, ululation, coronaphobia the world over with abracadabras,
coronavirus.
Hooray! It's the first edition of Sankofa Baye Challenge. Are you ready? Do you have the skills? Do you have the ability? Then challenge yourself to be a winner. Go to Google GhanaMotion.com, download King Jerry Sankofa and make a video of yourself dancing. Play the song from the starting and end it at the Baye point. Challenge yourself to be a winner. After making a video, send it to this number 0273-288-939 0273-288-939.
Support, your donations, and your patronage. We hope we can be bringing you this program every other Thursday. I'm just going to take a little time to acknowledge those watching us. Right now, Holiday Africa shared the stream and is watching. Mr. Pa Kwesi Sam is watching. Welcome, Pa Kwesi Sam, to the show. And Francis Kamor has a question. She says, if a hairdresser is doing a customer's hair and both of them are wearing masks, but you can still smell the customer's breath or whatever she talks, can the hairdresser get contracted in the case that the customer has the virus?
So I think maybe what the question, I'm going to simplify the question and say, if a hairdresser is doing a customer's hair and they're both wearing masks, can they still get the virus? I'm going to simplify it.
So she's saying she can still smell the customer's breath.
Right, because they're talking, right? So the answer is yes, because the masks that we wear, they're not 100%, they don't keep out the virus 100%. And the mask that we wear is to prevent the droplets. So like as I'm talking to you, you know how when people are talking, we have spit, right?
Some of the
fit you can see, and and some you don't, and
Right.
that's how the viral particles travel. They also travel, like, of course, when we sneeze we have a big forceful pressure, and that also aerosolizes, meaning it makes the viral particles travel in the air. So in a situation where somebody's doing somebody's hair, first and foremost, you guys are in the same space, which is the space that the droplets will fall, right? So the longer you're in the space, the longer you have a risk of exposure, because not 100% of the droplet particles are not going out. So this is the reason why hairdressers and stuff is really not a good idea right now. Um, Especially since we don't know people's testing status. For instance, if we have widely available testing, then like the hairdresser, could test more often, like you were asking, and then that you don't have the virus and you're not spreading it. And having the virus is not a negative thing, right? Like in Ghana, people get stigmatized
Yes.
because they have the coronavirus. Viruses that actually just, how wintertime people get colds and stuff and they think they have the flu, and then you get tested for the flu and it's not the flu. It's not the flu. It could be coronavirus, not this coronavirus, but the common cold
Right.
coronavirus, because we don't normally test for that. Normally we don't test for that.
Right.
So we all have them. So that's one thing I want to appeal to our brothers and sisters in Ghana, is about the stigmatization, meaning like if somebody has the virus and they're looking down on the person and they're treating the person badly, that is something that is not acceptable and does not go well for the community.
Right. Right. Miss Francisca Moore, I hope your question has been answered. Let us know if your question has been answered and if you need any more clarifications. I also want to acknowledge Abuna Asanti Wakrobia for watching. Ruben Hajide, thanks for joining us. Mr. Candy Ghana, thanks for watching. Rosemary Amagashi, thanks for watching. Mr. Candy says, great show. Atagana Yeboah is also watching. If I can't see you watching, or I can't see your comments, you're probably not my friend. However, try and leave your comments and questions, and our professionals will answer accordingly. Right now, I would like to welcome our knowledgeable Dr. Edward Ofori. He's joining us now. Dr. Ofori, how you doing? How was
I'm
your
doing
day?
good. How about you?
Great, great. Thanks for joining us.
No problem. Nice to have you guys.
So
Yeah.
we the females have been holding the fort before you got here,
Oh Lord,
like we
no.
always do.
Oh, she did not.
She threw in the female card, right?
The girl power.
Yep.
So
That's good.
Dr. Dr. Pearl,
Quartey.
For
Dr. Pearl,
per
Dr. Pearl.
Quartey, yeah.
Yes, Dr. Pearl. I want to find out from you. Are we going to see any? Is coronavirus going to be leaving us anytime soon?
That's a very, very good question, right? So nobody knows. Soon is the biggest
Hope.
thing. It's like, how soon? 2 months? No. 1 year? I don't know, because the virus is so ubiquitous, meaning it's like everywhere. And then apart from the bigger pandemic that's going on, like where meaning it's pretty much now in almost every country, there's like little epidemics that's going on, right? So even in the US, the epidemics are like happening in different areas, right? At first, it was like Washington State and Seattle, where it was like always in the news, Seattle, Seattle, Seattle. And then they shut down, they did their thing. And then the next thing we knew, it was in New York, right? And
Right.
the next thing we knew is like New Orleans. So the pandemic, like the epidemic is like hopping from here to here to
Right.
here. The places where we haven't had it too much are actually places that did the social distancing early. So, like, you hear the cases like in Illinois, we have quite quite a bit of 68,000 cases, but that's because we're testing a lot here in Illinois. So we're picking up a lot of the cases.
Okay.
And we haven't seen the level of death. Of course, even one single death is not acceptable, but we haven't seen the level of death that we've seen in, like New York. And our hospitals haven't been that overwhelmed like you see in New York. So, and I honestly believe 100, 200% is because we instituted the social distancing early.
Right, right, right. Dr. Pearl, have you, I don't know, how are you preventing, how are you keeping your immune system, how are you protecting your immune system, or how are you boosting it? Are you also drinking the Sobolo at home, and have your patients been coming up with concoctions where they believe
So,
is treating them
So
or is
I,
healing them?
so I normally in a normal every day, and I'm not gonna advocate for one thing or the other. You're asking about my regimen. I every day take turmeric every day for the last 3 or 4 years. I take turmeric tablets. Not because of my immune system, because I have a chronic pain issue, and I find that the turmeric helps with my chronic pain. So I take it every day. This is something that I've done for years. I also, try to sleep, although that's, very terrible at sleeping. I'm not a good sleeper, but when I get a chance, I will, take a Benadryl here and there and try to get good sleep. I don't exercise like I should. I should exercise. I take a multivitamin sometimes. The biggest thing I try to do is to watch my diet. Okay. Some of my patients will tell you I preach a lot about diet. I see food as medicine, right? There is a whole movement called food as medicine. So avoiding sugars and processed sugars, high fructose corn syrup. My kids all know about it. My kids all read labels and know
Wow.
that we don't do things with added sugar in it. I use a lot of garlic to cook in general. I use a lot of ginger to cook in general, not because of coronavirus, because that's how I do. I hardly eat any fried foods. I don't eat fufu because it's all carbohydrates.
What?
I'm, I'm already on the heavier side, and I try to. So these are that we do every day. I do every day here in my household. I hardly eat red meat. I eat mostly fish and chicken. And what else? Yeah, I really try to avoid processed food, and try to eat as healthy as possible within the constraints of the busy life and everything. Now, talking about concoctions, everybody has like their family tradition concoctions that they do. Like here in the winter time when my kids are sick, a lot of the cold medicines and stuff are really not that great for kids. Um, so I always have lemon and ginger. I have dry African ginger at home that I use for tea.
Okay.
Always have it. I always have lemon. We always do lemon ginger tea for regular colds and stuff. So I don't really do concoctions, but I try to live as natural as possible. Right. So I have Sobolo here. When I go to Ghana, I always have it. My husband likes to drink it. So ever so often I make some and it's in the fridge to drink. I also have uh, I like to season it with ginger. My husband likes making smoothies with stuff. So this is just stuff that we do all the time, not necessarily because of coronavirus. It's like if we could eat naturally and not eat processed foods, we actually wouldn't have as much sicknesses as we do. And our pharmacist will tell you all about it, I'm sure. We
Oh
won't
yeah,
need the
he
pharmacist
always
as
has.
much.
Yeah, that's true.
He always has enough
Okay.
information
So
for us.
yeah, I see all the concoctions that like onions are very good. My mom, God bless her soul, she always advocates for red onions. So like every day I cut red onions, I remember her because she's always garlic. And even when I was a kid, she would make garlic concoctions and drink them and have very bad smell. And we were always like, oh my gosh. So these are things that I have grown up with. So I think it's just things, a lifestyle that we should all adopt in general, is to eat natural, closer to the earth, closer to the food that God created that comes out of the earth, and less processed foods, and less sugars and less carbohydrates. We don't need to eat like a whole big piece of fufu like my head, right? Because we don't go to the farms. I mean, think about, like, fufu is like petrol for an 18-wheeler. Like, you need to go to the farm and weed when you eat fufu. If you don't, is all that carbohydrate just sits because you're not using it, and that's how we become diabetic and hypertensive. So my patients will tell you. I could go on and on and on about
Thank you, Dr. Pearl. Dr. Ofori,
Yes.
we're going to be tackling treatment of coronavirus. So I am noticing for some weeks now, when we had our program 2 weeks ago, I was telling you, anytime I had a patient on admission who tested positive for COVID, they were started on chloroquine or hydroxychloroquine. I hear it's not as effective as they thought it was or it was going to be. What is happening with chloroquine?
Right. So this is chloroquine, and chloroquine have been heralded as, I guess, the supposed treatment option that we have out there. Our dear president put up. In the beginning, I had my reservation about it because
Dr. Forrest, are you there? It looks like Dr. Forrest, can you leave the room and come back?
put tested, and the data is suggesting that even individuals who were placed on hydroxychloroquine are doing worse than standard. I wasn't too surprised. Medication, which is a RNA polymerase chain inhibitor, I do have some hope in that because of way viruses replicate. What that means is the way the virus reproduce. That drug kind of targets a pathway within the replication of the COVID coronavirus. So that one is gaining in terms of clinical data that is coming out. So I have hopes in that. My other hope that I have is when it comes to vaccines. So that is probably what is pretty much going to save us from this, since every longer period of time, even though vaccines also take a longer period of time,
Dr. Forrest,
we have a better shot. Hold on a second. Can you hear me?
I think you have to leave the room and come back, Dr. Ofori. We'll take a little break.
Hello?
Yeah.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello viewers, welcome back to the to the health segment on Trend Africa TV. Dr. Pearl wants to answer to the treatment of coronavirus, and we were asking about hydroxychloroquine and chloroquine. How effective is it now, and what is going on? Are we losing hope in that treatment? Dr. Pearl, over to you.
Thank you. So, as Dr. Ofori was mentioning, so as we all know, in the beginning, the chloroquine was believed in initial studies to be helpful in how the coronavirus enters the human cells. It kind of inhibits that step a little bit. A very small study was done in France in a French hospital, and it showed 80 people were in that study, and it showed that it seemed like they were able to clear the virus a little bit quicker than the patients that didn't get it, maybe 2 or 3 days. And based on this, as well as some other reports, that's when it became a thing because the president started making noise about it. But the thing about any treatment, the bona fide way to determine whether it works or not is to do a clinical trial. But because in this situation, the COVID-19 was killing so many people, and it was like, well, we don't know, maybe it might work, maybe it doesn't work. So then they started to use it to treat people. So the thing about hydroxychloroquine, which is a little slightly different in terms of its structure from the chloroquine, which we took as kids when we were in Ghana for malaria, is it's been used for other disease conditions already, but it does have side effects, and these side effects are worse in people that have heart problems and these kinds of things. So then when they started using it, they found that it actually was not as hopeful. But the thing is, it still hasn't been done in a clinical trial, so we actually still don't know because there's no, for instance, as Dr. Ofori knows, if I'm going to prescribe a medicine for high blood pressure, I know what dose to use because it's been shown in studies that if I give a patient 25 milligrams of hydrochlorothiazide, that's a good dose to start the person. But with the hydroxychloroquine, like, we don't really know. Some people are doing this regimen, and some people are doing this regimen. It's like here and there, like different things that I see. It's like not a standard thing. So I think there are some clinical trials going on right now with that. So, but in terms of its clinical use, where people have just used it, it hasn't shown to be as beneficial as it was initially touted to be.
Right. Dr. Ofori, as you were saying.
Yes. So what I was saying is that even though the drug was originally shown to have like some good benefits in about 28 people that were tested, we cannot extrapolate that number to the whole entire population.
Okay.
So we need to do like clinical trials in like thousands of people to be able to get a very good picture of what we expect. The other thing is, with Remdesivir, which is shown to have some good outcomes. People actually recovered 4 days earlier than compared to other individuals who are on other treatment options. So I have some kind of hope that we might get some what we call small molecules to help us. In the same way, with most viral infections that are very contagious, we might need a vaccine. And that is where I'm trying to educate people that there are so many anti-vaxxers out there that I'm scared that if we do find a vaccine tomorrow, we will still have a problem with trying to get people immunized. Because a lot of people are against vaccination, and we are putting all this effort towards developing a vaccine to kind of help us with this pandemic. The other issue will be how many people are willing to take it. And we need to do the education earlier to let people be aware that, it's not that bad, right? There was a publication that came out that kind of was published in a Lancet and put everybody to think that when you do vaccinate your kids or you do vaccination, it has a bad effect. And then on top of it, this French scientist or whoever he calls himself says they were going to test the vaccine on Africans. Now, yeah, now we have a very big problem on our hands in terms of that, and again, it will take some time before we can have a vaccine at hand. Whilst we're waiting on that, I think we have to start educating people for potential that if you do have it, what are the side effects? Is it true? You get it, what are the consequences you can get out of it? Does it have all these side effects? If I take it, am I going to get some kind of a chronic disease? We need to start education as early as possible.
Right.
Yeah.
Right.
So
yeah, go ahead.
So I actually do want to say something about the vaccination issue. Give me 1 second, please. Let me get a charger for my
Okay, no problem.
computer. I'll be right back.
Yeah. So while she gets her charger, I wanna, say this out there that a lot of people actually, we say we should wear the mask and when you go in public. One thing I'm noticing is that people are not wearing the mask the way they're supposed to. Okay. So today I went to the grocery store and I looked around and everybody pretty much has the mask on, but then it's only covering the mouth. I tell you, out of 10 people, and I did a little statistics, out of 10 people, 8 of them had a mask on, okay? But then it's only covering the mouth. Or in most cases, it's only hanging in the neck. So what good is it to have a mask and just have it put, and then when they're talking to you, they pull it down?
Oh,
like,
my goodness.
Dude, put it on,
I thought I was the only mask police. Yeah.
We need to protect ourselves. You need to act like everybody has the disease pretty much. And that way it helps us to contain it. Otherwise, we're going to be in this situation for a while. I'm afraid. But yeah, go ahead, Dr. Quartey.
Yes. So what I wanted to say about the vaccine, okay, I could go on and on about vaccines.
Yeah.
So after the French doctors said all those deplorable things that they said, okay, I had to do a lot of defending of vaccinations on social media. I got so tired. Okay. So what I was telling people is, yes, we in Africa, we're a vulnerable population. Yes, we've been used and abused in the past.
Yep.
Yes. But vaccines have actually saved our lives.
Yep.
In my mom's generation, okay, in our moms, like the people that are in their 70s, there were kids that, like families that the mother will have 10, 12 children, and half of them will die from preventable diseases, okay? When we were kids growing up, there used to be a whole public health campaign about the 6 childhood killer diseases. I don't know if some of you will remember that.
Yes.
Tetanus, whooping cough, measles, those all, like, there's a whole generation of people in Ghana that don't know about this because all these vaccines have been put into place. And because of those vaccinations, the rates of children living from 0 to 5 years actually increase so that people are actually growing into adulthood, where before people were dying, okay? Children were dying from diarrhea, from all these preventable diseases, okay? So yes, historically, we are a vulnerable population, but our governments are supposed to be the ones that are protecting us from all these vulnerabilities, okay? And then we come to the safety of vaccines. Vaccines are like drugs. They have to go through a very long process of development, okay? Vaccines are actually, I would say, even harder than drugs because you have to inject them, you have to mount an immune response, you have to see how they respond. I mean, it is complicated and it's like years to get a vaccine. So I was telling people, are you people seriously thinking that when there is a pandemic going on and the government, the I'm not going to mention names, but the government had to give something called emergency use authorization for vaccines to be accelerated. Do you think they're going to do tests in Africa? No, they're not going to do tests in Africa because they need the results fast, and they can't like be traveling, going to get permission because you still have to do IRB, get government. It takes months to go through that process. So the vaccine trials are going on now in the US. Do we have vaccine trials in Africa? No, because they're expensive and they're time consuming to go do vaccine trials in Africa. So in this context of the coronavirus, it's going to be a while before the vaccine gets tested in us because they need to get the results quickly to be able to get a vaccine in a year and a half. In the context of vaccines in general, if people are going to say, oh no, we're against vaccines and whatnot, it's to our own disadvantage because we're the most vulnerable and we die the most from vaccine preventable diseases. So I do agree that we are a vulnerable population, but there are human rights things that have been set in place, and that's what our government and our ministries of health and all these things put into place so that the population is well educated to understand what's happening so that the vaccine testing is safe. Now, even here in the US, every day, every winter, okay, I have to have a spiel about flu vaccines. Is the same thing here about people,
You don't.
especially in our African American community, because in our African American community historically have also been a vulnerable a group where we've been misused and abused and mistreated when it comes to doing clinical trials in this country. So there's a lot of mistrust of the health system when it comes to vaccines, and it's the same issues. Like, we have to get there. Vaccines, like any other medicine, have side effects, right? So not all of them, not some have worse side effects than the other, and that's why they do the trials and try to figure out. There's a whole reporting system where we're supposed to report vaccine adverse events and all these things. So yeah, so that's my spiel about vaccines. There are a lot of anti-vaxxers here, like measles, for instance, in America was like not heard, like not a thing, but now there's all these things. So now measles is becoming a disease here in America again. Um, Pertussis, which is whooping cough, was the same way. It was not a thing anymore. And now because people are not, doing that, and also the immunity goes with the vaccine goes down, it's pertussis is becoming a thing again as well. So this is what I want to say about vaccines. Just like anything, any drug, it has its good sides and it has its bad sides. And the government has to put checks and balances in place so that its population doesn't get misused, doesn't get abused, or
Right.
whatever. You know what I mean. Take advantage of.
Stage of right. So thank you, Dr. Pro. Um um Anyone can answer to this. After you recover from the coronavirus, do you um do you have antibodies? And then I also heard that now after they recover from coronavirus, they are having the recoverers donate plasma, which is now in turn used to treat those who are infected with the coronavirus. Um, Dr. Ofori, have you heard about this new plasma treatment?
Yes. So again, going back to the vaccine issue. So one problem that we have with our Ghanaian community is that even when a vaccine is available, they think it's a test. I don't know if you're getting what I'm
Right.
saying. So the final product, we've done all the clinical trials and everything. We ship it to Africa, and people still think it's actually not the vaccine itself; it's the test that they're going to do. So that is one thing that we want to put out there. Regarding your immune system and how you respond to infections, of course, whenever all these vaccines, majority of them, tend to stimulate your immune system to build some kind of soldiers, right, to fight the infection when you encounter it again. So our immune system is very important when it comes to preventing and fighting infections, viral infections, and so forth. So, based on that, people who have the coronavirus tend to develop antibodies against the virus, right? So that antibody, from what we know, and based on what happened with SARS, okay, we know that that antibody for SARS circulates for more than a year at least. So we know that people will have a probability that they will have this vaccine for a longer period of time. Sorry, the antibodies for a longer period of time, and that will give them some kind of protection. Now, what happens is that if your body has those antibodies, you can pick the blood and kind of get a plasma, which is when you spin it, you get a liquid part of the blood, and that will contain those antibodies that can be injected to an individual who's have the disease, and that will help them fight the infection. So it's some kind of a passive immunity that can be taken from one person. We do a thorough cleaning, or make sure that the person doesn't have any kind of disease that can be transmitted to the other individual, and that liquid part of the blood, which is a plasma, can be injected into the other person who has the virus, and that will help the recovery process. So that's pretty much what is going on, and there's some good information or some good data coming out of that particular kind of method.
Dr. Pearl, do you have anything to say about the blood plasma?
Yeah, so the clinical trials currently ongoing for that. And that treatment is reserved for patients that are very critically ill.
Okay.
So one thing that we have found is for people that get very sick from the COVID-19, somehow there is like this immune overstimulation, and somehow, even though the immune system is overstimulated, it still can't function. There's like this immune dysregulation. So the belief is that if somebody has gotten the virus and has been able to make some antibodies, giving those antibodies to somebody whose immune system it's like you're trying to spark the car, but it's not spark. It's like training. When it's like the immune system is not functioning. So maybe giving them the antibodies that are already done, like Dr. Ofori said, it's passive immunity that could help them then try to overcome the hump so that they can recover from that.
Yep.
I haven't seen any papers written at all yet about any initial results, because like in my hospital, we're still recruiting for that. It's called the convalescent plasma study. So hopefully, yeah, but this is reserved for people that are critically ill. Usually they're in the ICU quite ill. So we'll see how that goes.
I want to thank Steve Dare for joining and watching us. Steve Dare says, great presentation, Dr. Ofori. Bernard Forsen is also watching. Pearl Yara Agboka has a question. She says, or she asks, is it possible for someone who already takes hydroxychloroquine for another health issue to get infected with coronavirus?
Very, very good question. Excellent question. So usually people that take hydroxychloroquine usually have an immune issue. Okay. The most common use of hydroxychloroquine is for people that have certain immune system problems. So I'm thinking that because the people that have a lower immunity are more susceptible to the coronavirus, that most likely those people can get infected from the coronavirus. Now, does the fact that they're taking the hydroxychloroquine give them protection? That I don't know. Again, those can be done in studies. Usually that would be like something called a prospective study, where they would take thousands of people and then they'll look at all the people so it would be like a study. Let's say the NIH does it. They pick 10,000, 20,000 people across the country, and then they literally do a survey and find out who's on hydroxychloroquine, who wasn't, what diseases they have, and over like a year or two or maybe 3, see what the outcome is. Like, oh, when we did the study and we talked to these people, some of them looked like the fact that they were taking it maybe helped, but we won't know until we do a large, usually a prospective study where we study a large population and see what happens with those people. So right now, I don't know that taking hydroxychloroquine will prevent you from getting coronavirus. What I do know that people that have to take the hydroxychloroquine usually have an immune system that is not perfect. Not that we all don't have it, but they are more susceptible to getting sick from coronavirus. So I would still say they have to be super duper careful. If they can, social distance and all these things, washing hands, trying to avoid being around somebody that is known to have it, take extra precautions.
Right. Paul Agboka, please let us know if your question has been answered. I would also like to take a minute to thank Mrs. EuniceCromwell. She's on the feed answering questions as much as she can. That is why you're not hearing of her, but she's still here. She's with us. She's hearing us. She's answering questions. So please post your questions. If I get to it, I will get to it. But if I don't, and the program is over, our professionals are still answering questions. Bernard Forson says, I am learning a lot from these presentations. Ni Okai also says, I think people have to try Sobolo. So this Sobolo issue is never going to end. It's still pending, I guess. And then Jeanette Penny Laye, thanks for watching. So we are going to take a little break, and when we come back, we'll bring the program to an end, and then we'll take our ending remarks, our closing remarks from our professionals. Don't touch that dial. We'll be right back.
What did you do for here? Come here.
It's like he was born for this. You think you can one day fall from a taller tree?
Hey, Pierre,
take a look at it.
Oh, that's harsh.
No be your mama and Bobby Mashna Mbanga before they send you for school. Be careful. What kind of fashion is?
Which kind of fashion?
My hell, career partner now to you. I teach you what.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Welcome to Africa. Hey, Mama Africa, the land of peace, gold and diamond. Welcome to Africa. Hey, Mama Africa, dark and lovely, beautiful people. Hey, 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 don't mind people say. I said, don't mind people say. Don't mind.
What it do, my people? It's your boy Kingsley Ego B, aka King the Preacher, aka the Peacemaker, aka the joy of the people is my peace of mind. You are now watching Trend Africa. Don't touch that dial. If you won't touch her. Come on there. Keep watching Trend Africa. We are here. Africa has come to stay. Don't touch that dial. One love. Keep watching. Ratata.
Berinti winim sama fewo. Mafisade osife mano. Ebi ano eobi. What's up? This be your Chocho Mucho Bless and you're live on Trend Africa. Keep watching it. Blessing the microphone, blessing your ears. Moonlight, loving.
Baye, kekelemi. Yo, Ghana, worldwide, Africa. This is your boy King Jerry, the Rhythm Styler, Sankofa Hitmaker. I watch Trend Africa TV. Watch Trend Africa TV every Wednesday with Black Jesus. Charlie, Trend Africa TV, the best online TV worldwide. Rhythm Style, bye.
Claim sister Nabi Boso Shabi Papa wrote this. The goddamn boy, I mean this. We love Royal Black Jesus too much. Who live in Chicago. If you want to see him, follow him Facebook. Tender African TV and say Black Jesus. Manabada, we tell you say Manabu too much. In Chicago, they love him too much. So want to follow him in Facebook. Tender Africa TV and check Black Jesus. Manabada and to realize no matter what happens, we can music, we are going here. Papa wrote the golden boy message of Black Jesus. Long so time.
Yo, this is Atagana Boy. Keep watching Trend African TV.
This your boy Chef, yeah boy, you already know, man. Trend African TV is the way to go.
Boss man Kobe, man. Trend African TV, we're live.
You know it. Yo.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello everyone, this is Empress Mousy on the health segment on Trend Africa TV, and I just want to thank everybody that joined us on the show today. And I know you guys will agree with me that today's show has been, we're getting better every week. Thanks for your patronage. On the CDC guidelines, one way we can prevent the spread of coronavirus is by thinking everybody is infected. Do not go out there thinking, oh, I am okay, I'm not having symptoms, or this person don't look sick, so I'm going to be hanging around. No, you can actually infect each other without showing symptoms. And this virus is also spread by droplets. One way you can prevent droplets from spreading to the next person, the CDC has advised that you can put on the cloth mask. So this is a regular cloth mask like this. And this is from one of our sponsorship called Odinuhun Designs. He has provided a couple of the cloth masks. This is a suede one. This is a designed one. This looks like somebody, it's got chains on it, so maybe 2 chains can wear it or something, I don't know. And it's got beautiful African designs, and we are going to be having this at a discounted rate. So I will not call the price here on air right now. However, if you are interested in any of these beautiful African design masks, they are equally effective. They are not 100% effective. However, something is better than nothing. I always say that, So the only problem with this mask is now people are enjoying the roots of their own labors. When you have bad breath, you can just contain the bad breath, and you can be smelling your own breath, and you can start doing something about it. So these masks are very beautiful, and I wear them always, and people are always chasing me around for them. So I have um a new consignment over here. I have about 100 pieces to go, and they're going fast. I have only about 60 left out, and I received it only 3 days ago. So if you are interested, please leave your comments, get in touch with us, and then I would mail it to you or meet you wherever I can meet you, but we'll be 6 feet apart, and I'll throw it to you or something. We'll do something. We'll work something out. However, so right now, that was just a joke. Right now, I would give our professional panels the platform to give us their closing remarks, and maybe there's something they want to add or something they want to address that I wasn't able to get to. You guys know we've spent a lot of time so far, so I will start with um, Dr. Pearl Quartey, and then we'll go over to Mrs. EuniceCromwell, and then we'll finish up with the gentleman. So, Dr. Pearl Quartey, what else would you like to let your viewers know, and what is your closing remark?
Yes. So what I do want to say is that these are very tough times, right? It's like anxiety provoking. Some people have been laid off with all the social distancing and the economy and parts of the economy shutting down. That it's caused a lot of anxiety amongst people. Mental health issues is becoming an issue now. A lot of depression and anxiety. Even I myself, historically, I say, oh, okay, in our where I come from, I'm tough. We don't get depressed. We African people, we don't get depressed and all that stuff. That is not true. We suffer from depression and anxiety just like anybody else. Maybe the thing that we have an advantage of is we may have good social networks and social systems that help us deal with it a little bit more, but nonetheless, we have it. So I would really like to appeal to people that if you're having any issues with anxiety, you're not sleeping, your heart is racing, related to the current pandemic, or even in general, if you have that, you need to reach out to somebody. If you're part of a church, a body, maybe you can reach out to the pastor. You can reach out to me through Trend TV. Reach out to somebody and talk to somebody because the mental health implication of this pandemic is very real. The other thing is, I also, even though this is a tough time, some of us are not working, but we're at home, and I would like to say we should take advantage of this. Like, I've been cooking more, I've been trying all sorts of Ghanaian recipes. I tried to bake a cake. So we should see the bright side of this, right? Like, a lot of families, especially here in America, we're running around, we're chasing after God knows what. We're waking up in the morning trying to avoid traffic, hardly seeing the kids. It was a crazy life. So I think even though the circumstances was not what we wanted, we should see the positive side of it. God is telling us something that we need to slow down and all this stuff. And then I have to put on my doctor hat again and say, please social distance. You don't need to go to the store every day. You can stock up for 2 weeks of food. I know there people, not everybody can buy food for 2 weeks. I know that's a real thing. Some people literally have to go day by day to eat. But if you, as much as possible, try to social distance. This is also a time that we can reach out to our neighbors. If you live in a community, you can literally wear your mask, go knock on the door 6 feet away and say, hey, what can I do? How can I help you? This is the time that we can actually reach out to our neighbors as well and be good citizens in wherever we are, whatever community we are. I think that's all.
Before Eunice takes over, Dr. Pearl, are there any resources in the community you would like us to know? How can we How can we get some information or resources?
So that's it. So in Ghana, there I have something on my WhatsApp about reaching out to some telephone numbers. Maybe I can give it. I can send it to Eunice, and she can
Okay. Update.
we can post it. You guys can post it here
Okay.
for people. So that's in Ghana, and then here, I know it's hard. Like people are uninsured, don't have doctors, but I mean, you should reach out to your primary care doctor. Maybe Eunice might have more ideas. That's all I can think of. It's like reaching out to your doctor, or I mean, this is not a good time to go to the emergency room with all the COVID and stuff. So,
Right.
reaching out to your church community, reaching out to somebody, a friend, just reaching out to people and say, hey, I'm not doing too good, I'm not handling this too well. And then based on that, we can, the community can see how we can rally around. But you have to reach out to Pakwesi Sam. He's the president. Uh-oh. President of the Ghana National Council, and he will help, direct you towards how we can help you. I can, I'm always available to Pakwesi and the Ghana National Council for anything. Eunice knows that. So just reach out. Don't sit in your room. Don't feel like you're the only one and it's Ghanaians and they're gonna talk about you and do kokonsa about you and all that. No, don't worry about any of that. You need to reach out for help.
Okay, guys, you heard Dr. Pearl. Dr. Pearl. Eunice, are you there?
I'm here.
Okay. Any remarks? And what is happening in the community? How is Pakwesi Sam doing? The president of Ghana National Council.
He's doing very
I
well,
put him on
and
the spot.
we're so grateful that Ghana National Council was able to help out the best way we could with our COVID-19 care packages. To date, we've given out about 120 care packages. We are still receiving donations. So anybody who is willing to donate, they can always contact me or visit us on Facebook and just put a request out there. And we are taking donations for food, for water, just to continue helping the community out the best way we can. I think one thing that is very important is that we should just really take this time to just consider safety. I've heard a lot of things in the news where people are trying to self-medicate themselves and trying to rid themselves of viruses that they may or may not have. So I will encourage everyone to, not drink bleach. Don't use cleaning products and drink them and think that you're going to get rid of the virus. There's also been an increase on the amount of people who are drinking alcohol. That puts everybody at risk because if someone's drinking more alcohol and they drive and they end up hitting you or hitting your family member, it's a social responsibility for us all. So again, frequent or excessive alcohol consumption will increase your risk for more health problems, and it will not get rid of COVID-19. So we just need to be wise during this time. Please follow recommendations from the CDC or the WHO organization. And of course, if you're in the community and you have any questions or concerns, I'm always available. I have lots of resources. So things that I don't know, there are enough people, enough professionals in the community that are willing and able to answer questions. As Dr. Pearl said, there are tons of resources that we have access to. So please don't be shy. Please post things. If you don't want to let everyone know, feel free to send a private message. We can all get through this together. Once again, I thank you always for having us on every other Thursday, and I look forward to continuing to move forward through COVID-19. So thank you.
Thank you, Mrs. EuniceCromwell. And the last but not the least, our knowledgeable Dr. Ofori. Dr. Ofori, what would you like the viewers to know, and what are your any remarks?
So they've said a lot. Dr. Quartey and Eunice have said a lot about things that we need to do. I think what I'm going to add is that we need to take care of ourselves. As we all know, there's a big disparity even when it comes to this pandemic, right? It's affecting a lot of Blacks and Hispanics. We are very vulnerable because we have a lot of hypertension and diabetes and things like that. So overall, I advise that we should take good care of ourselves. We should eat well. We should sleep well. Make sure that we protect ourselves, like we keep 6 feet and all the things that we need to do. The other thing I'll add is that in the United States, and I know other countries are also trying to open up, as we try to open up, we should be very careful. I'm telling you, in Chicago, it's so cold when it's like 60 degrees. We all want to go out there, right? And kind of, mingle with everyone. But we have to be very careful. We have to remember that there is still COVID because people get excited. And like I said, people are wearing their mask, anyhow. And part of it is because we get excited and we forget that it's COVID. It's still out there, even though the season is changing and all of that. So I will encourage everyone to be cautious and know that think everybody has the disease and be conscious about it and make an effort to prevent yourself. So that's the note that I'll leave everyone.
Thank you, Dr. Ofori. Karen Amposa is watching. Simon Ado is watching. Nanayiri Papebi Atefua is watching. Efa Ameyao is
Interesting
watching.
name.
Efa Ameyao also said, great show from a great station. God bless you, Empress and the guest. The information being given is key to our very survival. I'm learning a lot. Thanks. Sena Alinko also says, great show, excellent production, best African TV in Chicago. Nana Ketrim Mafo joined us again. Claudette Martinez Sapon, job well done. Kakape is watching. Pa Kwesi Sam, thank you, my sister Pearl, for being there for the community. God bless you. Pearl Agboka, great show. Thank you all for putting up this show. It's been very helpful. Bernardine Pra, awesome show. Claudette Martinez Sapon, great job, Eunice. Claudette also went on to say, Empress Mousy, job well done. God bless you. God bless you all for joining us on this show today. It's been a very awesome show. Like I said last week, and I'll always continue saying, it is your own personal responsibility to take care of yourself. It doesn't matter what your government says or whether the society is reopening or not. If you have to drink, just go get your booze and stay at home and, enjoy your booze. Or don't drink at all,
Immune system, a way to boost your immune system is not drink.
Okay, well, we'll drink Sobolo then. Well,
Well, it will make your immune cells not function.
Yeah.
You asked me how to boost your immune system? No alcohol.
Okay, doctor. You heard that from the doctor. So we all need to take a collective action now to contain and prevent the spread of coronavirus. We cannot continue to live in fear. That is why it is important to listen to your professionals and experts in coronavirus. Don't come up with your own concoctions. We are going through a whole length. We're going through a lot just to get this professionals who are volunteering to give you all this information for free. All you have to do is share the page, ask questions. And one thing that saddens me is when we have informative programs like this, our numbers are just stagnant at maybe 20 to 50. If I was to take my boobs up and be flapping it right now, oh my God, my numbers would be like over 1,000, 1K, 2K, 3K. Oh! I think I love this doctor. I really love her. We've got awesome people on this show. Dr. Ofori. I know, you can. It's too informative. We are too decent. And it's very pathetic. It's very pathetic. However, we want to thank all these wonderful professionals. Dr. Ofori, Dr. Quartey, beautiful lady, handsome man, and then Miss EuniceCromwell. I cannot thank you enough. I cannot thank you for being part of this show, always coming up with a topic, always coming up with resources, volunteering for nothing. These are the kind of people we should be grateful for in our community. She's sacrificing her life, her time, her family time just to do all this for the community. However, we still have backstabbers out there. We still have people who always want to talk about the negative. But she always tells me, Mausi, you cannot concentrate on the negatives. Be who you are, and I know we can make a change in this community. I want to thank the Ghana National Council for their support, and our sponsors, Omama TV, Powerhouse Restaurants and Media, Holiday Africa, Mado's Design. Anyway, Eunice, in collaboration with Mado's Design, Trend Africa, we are donating 20 pieces of cloth mask. No, is it 10 or 20? 10 pieces of cloth mask. So we are going to be donating it to the GNC, and I hope I can meet you, Eunice, and hand them over to you. I've already received the mask, so I'll hand them over to you. And I also want to thank Odinuhu Designs for sending all this masks over. We're going to be selling in the community. Thank you so much, guys, for watching. Until we meet again in 2 weeks on Thursday, stay blessed and be safe. Good night.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Man to man is so unjust. You don't know who to trust. Your worst enemy could be your best friend. Sing with me, y'all. And your best friend, your